So all the symptoms that can come along with this, big things, anxiety, the fast heart rate, the low blood pressure, the dizziness, maybe like rashes, allergy symptoms,
Yeah, a lot of acid
HS.
reflux, nausea, it can be diarrhea or constipation. A lot of vision issues I see with clients, frequency of urination. Almost like a lot of clients will think they have interstitial cystitis and get that diagnosis when they're in mold or have an MCAS flare and not realize like waking up in the middle of the night to pee. I would also describe the anxiety or depression differently than I would anxiety or depressive symptoms differently than I would. A lot of clients who have histamine issues describe anxiety as being a very physical anxiety. So it's like you
Right.
feel like ants are crawling under your skin, extreme insomnia, again, fevers, like it can look like you're just sick also. And that's really the problem with it. You can have high heart rate.
Hello, everyone. Welcome back to the Dr. Lowe Show. It's great to have you. I'm kind of selfishly doing this topic because this is something that completely relates to me because it's always about me on the show, just taking you along for the ride on my geek journey. So I came across this amazing woman on Instagram and I was just so impressed with the content that she's putting out there and just how relevant it is to a very specific type of population that is very underserved in medicine, and just wanted to shed some light on this topic and really give you guys some information to arm yourself, because if you're dealing with these types of issues, you're probably feeling like you're in the dark. And when you go to your doctor, they're probably looking at you crazy, like, what are you talking about? So wanted to give you some information so you're able to arm yourself and just have some good takeaways on how to address some of these issues. So without getting too much into it, a little bit about my guest. We have Michelle Shapiro on the show. She's an integrative functional registered dietitian in New York City. I don't know why I love New York people.
Oh,
It's refreshing because I'm in San Diego, so it's just such a different vibe.
I
But I
think
love
beach
it.
people and city people love each other, by the way.
Yeah, I
That's
think
how I
so.
feel.
I think so. We're like very compatible. Uh, she's helped over 3,000 clients reverse their anxiety, heal longstanding gut issues and immune issues, and approach their weight in a loving way. She has a virtual private practice and she has 5 nutritionists on her team she works with one-on-one towards these goals. She's the host of the Quiet the Diet podcast, and we'll put a link on for that in the show notes, where she helps listeners bridge the gap between body positivity and functional nutrition. I love that. I love that so much. So Michelle, welcome to the show. It's good to have you.
Dr. Lowe, I'm so excited to be here. I really am.
We're also IT whizzes. Before this, we figured out how to completely
How to work
change the
Zoom.
game on Zoom. We had some tech issues and we worked it out. So we're multi-talented. But I wanted to dive into a little bit of why this is something you like to talk about. This is a very, where we're going to be talking about MCAS, which is mast cell activation syndrome, where we talk about anxiety. I love to bring in, hypermobility and histamine and, POTS and all of that, really for myself, but people can listen along too. But why is this something that you like to talk about? And I know you've had a bit of your own journey with it.
Absolutely. Yeah. So I live in what I would describe as a highly sensitive body. And I use this term a lot in my client population. You'll see me using it on Instagram. Someone who lives in an HSP. So it's different than being an HSP. But I noticed over my years of life and health crises that I encountered, which so many healthcare professionals, we want to find the answers to the problems that we're having ourselves, honestly. It's why we're sitting and having this conversation today, right? Like
Yeah.
it's really the truth. But for myself, I always noticed if I went to a functional medicine doctor or a naturopathic doctor and I would do an intervention, I would always feel sicker. And I was like, it's not that these things aren't working for me, it's that I literally would get sicker. I would do the IVs, I would do the mold detoxes, parasite detoxes, and I would just get sicker and then my baseline would be sicker. And I always had these
Mhm.
very unexpected symptoms. And I had an encounter with mold and COVID, which I lovingly refer to as the mold vid era of my life, where I was so sick in ways of insomnia, anxiety, tremors, gut issues. And the more that I engaged in functional naturopathic medicine, the sicker I got. So I used to be a functional dietitian who people would come to when conventional medicine had failed them. And that's very common as a naturopathic doctor too. I'm sure you get that a lot. What I've been seeing in the past few years is clients coming to me when functional medicine fails them. So it's
Yeah.
like there's like another stop on the train, basically,
Mhm.
because there is a type of body and a type of person who, if you give harsh interventions to them or even like gentle interventions like a B vitamin, their body reacts in these really unexpected ways. So I've been on a journey to find answers, solutions for people living in highly sensitive bodies, because I notice there's a lot of patterns and there's kind of a very clear picture. And when you can see what that picture is, it's pretty life changing. And I know for myself in my health journey, when I was in a neck brace at one point because I had a chiropractic injury. I was sleepless. I was anxious. I had panic attacks all the time. I sick literally all the time. Dr. Lowe, I was going to Reddit for answers. Like that was the only place I could
Right.
find answers, because how do you explain to Google, why am I dizzy on day 9 of my period? Like
Right.
that doesn't mean anything. There's no textbook answer for that. So I started to
Mhm.
kind of draw this map and understand, what is this highly sensitive body? How does it relate to histamines? How does it relate to blood flow issues? How does it relate to the nervous system? And I've kind of created this understanding of this pattern recognition that I'm really excited to talk about
Love
in hopes
it.
it'll help
And
someone.
I,
Yeah.
I I definitely want to dive into, what are some things that ended up working for you. So
Oh,
let's,
yes.
before jumping into all that juicy stuff, I want to bring it back to what the heck is MCAS? What, like how, like what's at the root of that? Is it different than just regular histamine issues or allergies? And,
Yep.
what are the kind of connected, all those different connections with other conditions?
This is the joy of my life to talk about this. I can't wait. And I feel like when I see the conversation around histamines online, we're often really missing the point. So I want to walk it back to what even is a mast cell before we even talk about MCAS or histamine intolerance. So mast cells are a form of white blood cells. They're a part of our immune system. And their job basically is to process threat and to send resources to the rest of our body in times of threat. So I almost think of mast cells as being like the guards on the watchtower of our body. So in the example of something like COVID, let's call it, because that's going to be a part of this conversation for sure when we talk about MCAS. It's almost like they're these little soldiers who are looking over the watchtower and seeing all the damage that COVID did. And then your mast cells are saying, well, I never want that to happen again. So what they'll
Mhm.
do is mobilize these chemical messengers, one of which is histamine, but there's actually 1,200 different messengers that they will send out to try to either clean up the debris, get blood flow or nutrients to an area, and start the repair process. And more importantly, prevent that from ever happening again. Whatever they think is
Mhm.
going to prevent this issue from happening, they will do that. So mast cells have receptors on the outside of them, and then they have sacs on the inside, essentially, where they pump out these messengers to send signals to the rest of our body. They almost act as hormones or neurotransmitters, these little messengers, and they have many different modes of action. We hear a lot about histamines, which is one of these messengers, because they seem to wreak havoc when they are too high, we haven't removed them properly from the body, or we are intolerant to them being there. Like it's just, we have more of an impact from them being there. So
Mhm.
understanding that our mast cells are part of our immune system, but they interface with our nervous system. So we've seen this example a lot, and I know you've talked about this on your show before, like the stress bucket, right? Like once the inflammation
Yeah.
bucket or the stress bucket gets overfilled, well, our mast cells are pretty similar. So if they see a threat from one direction, like a nutrient deficiency, and then they see you try to do a mold detox and kind of push the buttons on your liver with another thing, and then you exercise too hard, and then you get too much sun because it can make you heat intolerant, and then you have a lot of, again, mental or physical stress of any kind. It kind of all adds up to where your mast cells then say, okay, I'm going to stay on and firing off these compounds. And that's what mast cell activation syndrome is. It's too much activation of your mast cells. And
Mhm.
one thing that I think is profound to talk about when we talk about this is that COVID as a virus attaches to and attacks our mast cells directly. So, this conversation around long COVID, we can't really talk about without talking about our mast cells. I think that it's the most important part of a long COVID conversation.
I just had a light bulb go off. When I had COVID, I had a crazy rash all over my body.
Mm.
That's
Yeah. Sorry,
interesting.
by the way, that you had that. Yeah.
Yeah, oh gosh,
Yeah.
it was crazy. I took pictures. I it looked like I had like lip filler, from my face
Yeah.
swelling up. But that's not typical of everyone who has COVID. And,
No.
before we hopped on the recording, I was saying that I really feel like I relate to a lot of these issues. I think I do have mast cell issues. I'm pregnant now, 4 months pregnant. So
Woo! Mazel tov. That's amazing. Yeah.
so, I feel like that is a factor. I don't know if maybe
It
it's made
is.
things better or maybe made things worse. It's hard to say. My body just feels weird right now. I'm like,
Everyone's
"What's
different, by the
happening?"
way. I
What's
have
that?
clients where MCAS is much less active during pregnancy because the immune system starts shunting all of its effort into the baby. versus I have clients who, just because there's such a hormone push, and we can talk about the relationship between mast cells and hormones as well, that also can make people feel a lot of symptoms during pregnancy. So
Right.
it really
Yeah, it's been
depends
a
on the
mix.
person.
Yeah, it's
Yeah.
been a mixed bag. It's interesting. And I'm 44, so it's different than when I had a kid at 38. It's, night and day.
Yay. So
But
exciting.
yeah, this is really interesting stuff. So how does this relate to some other conditions like POTS, hypermobility? I know like ADHD, neurodivergence, there's like all these different interconnected
I just
webs.
cannot wait to talk about this. So, the first thing I want to mention is how it relates to long COVID, because I just have to, again, emphasize this relationship between them is why I think you can't open Instagram now and not see the word histamines. I think that there's been an explosion of histamine like reactions that have happened in the past 5 years since, oh my God, it's been 5 years. Woo,
Mhm.
since COVID, right? I will also say that some people may have reacted to what let me walk it back. I think people had a lot of nervous system and immune dysregulation that we weren't aware of, and COVID kind of like exposed that for a lot of
Yeah.
people. It is they've done surveys state by state to see what the prevalence of long COVID is, which is, do you have symptoms after 3 months of getting COVID? Some states, the numbers are up to 35% of the population has long
Wow.
COVID. So we're talking about mast cell activation syndrome and long COVID being a massive and prevalent issue. And it's also grossly underdiagnosed, obviously, as we can imagine.
For sure.
We estimate that between 10 and 17% of the population has MCAS as of like 2021. I can imagine now it's much higher. So,
Wow.
one of the actions of histamines that make it so helpful is it causes something called vasodilation, which is the widening of our blood vessels. So, any medical professional will instantly understand and know this. If you want a visual and you're listening and you're not a medical professional, and I'm very happy that you're with us, even more so, it's like you almost like your blood vessels are opening and widening, right? So I want to take us through an example of what a histamine reaction would look like and how it can relate to a blood flow issue. So if someone goes into a shower, for instance, and there's a lot of people who go into hot showers, and then they look after they get out of the shower and they have like red bumps all over their legs and they feel really dizzy, they're like holding onto the wall kind of
Yep.
feeling. What might be happening in this scenario is that histamines are vasodilators and heat is also a vasodilator. So if your blood vessels open up wide and you're standing in the shower and you don't get the pump back up, you're dizzy because there's not enough blood flow to your brain. And
Yeah.
that's what that dizziness comes from. What people will also notice very often with histamine issues is tachycardia, like really rapid heart rate. So, what's happening in this scenario? You see the redness in your legs. That's literally blood pooling. That's the blood going down to the area. The reason that histamines cause vasodilation is so that immune cells and nutrients can get to a site of injury really quickly. The problem is, if we have constant histamines, our blood vessels are going to stay open and then we don't get that blood flow and pump back to our heart and brain. The reason that
Mhm.
our heart starts pounding when we feel like that is not just from anxiety, but because our heart is like, oh my gosh, I need blood flow up here too. So this relates to another syndrome that we see in long COVID a lot, which is POTS, which is postural orthostatic tachycardia syndrome, which literally means you make positional changes. You go from sitting to standing and you get a rapid heart rate, essentially,
Mhm.
postural tachycardia. So I see the relationship between histamines and MCAS and POTS a lot in this vasodilation piece because the nervous system is not appropriately telling the body, where do I send blood flow? And I know we can talk more about POTS too, and there's loads we can say about it, but that's kind of bridging that connection of one important way in which MCAS and POTS are related.
Dang, that was so good. That makes so much sense. And that makes sense why, for some people who deal with this, they maybe exercise and their nose gets stuffy or they get a runny
Yes.
nose, or people who have like chronic migraines, because that can be a vasodilation issue.
Oh, the migraines is my favorite thing you just brought up. Oh, I just get so excited to talk about
Yeah,
histamines. I
talk
can
about
get excited.
migraines,
Exactly.
how that's
Yeah.
related.
Most migraine medications are vasoconstriction medications. So if for anyone who's listening, we all know that Excedrin migraine has caffeine in it, right? This is like
Right.
something we know. And we think about caffeine as raising your heart rate, right? Potentially increasing blood pressure as well. So vasoconstriction, if you're thinking of like the tightening of blood vessels, can cause it can cause increased blood flow out of an area. It doesn't necessarily, but often migraines come from too much vasodilation. And which means that maybe there's blood pooling in the brain, vasoconstriction, the blood vessels will close, and hopefully that gets a pump going out of the brain, or there isn't just constant blood heaviness going on in the
Mhm.
brain. So,
Wow.
ice is a vasoconstrictor as well. So, like, I have people ice their necks oftentimes. But and also it has another added benefit in POTS, which I just want to mention one thing about POTS. It's fascinating. We think of POTS, this condition where we go from sitting to standing and we feel extremely dizzy. We feel like we almost can black out. Some people faint and we feel our heart pounding. I just want someone to think about, if you haven't experienced that, or if you have, how freaking scary that is. If you're literally, your heart is pounding out of your chest and you're dizzy and you don't know why, it's a really, really scary thing that happens. So oftentimes when people have POTS flares, they end up going to a cardiologist, right? Because they say there's something wrong with my heart because my heart's pounding out of its chest every time I stand up. There has to be a blood flow issue. The
Right.
fascinating thing about POTS is a form of dysautonomia. It's a form of dysfunction of our nervous system, our autonomic nervous system. So it's really weird because you'll go to the ER, you'll go to a cardiologist, and they're like, we don't really treat this because it's not really a heart issue. It's a brain issue. It's a nervous system issue. And that's
Right.
because our nervous system controls where does blood go? Should this muscle pump? Should I send blood flow to this area? The brain is the control center for where blood goes. Should I send blood to the heart? And so fixing, quote unquote, fixing POTS, or reducing POTS flares and increasing your baseline is really about the nervous system more than it's about the cardiologist. And that's really weird because the symptoms don't line up with the root cause. So it's really hard for people
Right.
to get care oftentimes.
How does conventional medicine treat POTS? I know how naturopathic or how I would address it, but I'm not familiar with how they actually treat it.
Yeah. I call it the go-gurt strategy. So basically what they do is, if you think about people wearing compression socks and abdominal binders, you basically just squeeze the blood flow so that like a go-gurt tube. If you squeeze the middle of a go-gurt tube, it
That's
basically
so
pushes blood
funny.
flow up back to your heart. So oftentimes the strategy for POTS is, how do we just get the blood from a symptom perspective back to the heart and back to the brain? By the way, I use compression socks with so many of my clients and abdominal binders. I go-gurt my clients all the time.
Yeah.
However, that's not as much root cause, but it
Right.
does really help because it's also much better if your blood, your heart gets blood so that you don't have that reactionary tachycardia.
Exactly.
Oftentimes POTS, oh, sorry, were you going to say something? I don't
No, I
want
was
to.
going to say
Yeah, yeah.
exactly. I
Yeah,
see that
good.
too.
Oftentimes there are different types of POTS. There's three main types. One is hypovolemic, which means you just don't have enough blood volume. So what happens is, you don't have enough blood volume, you don't get the pump, and then you have that vasodilation, and then the blood's just sitting there. It's not going there. So when you fill the blood up, you actually can increase potentially blood pressure and get the blood flowing to the right place. So if you have hypovolemic POTS, low blood volume POTS, the intervention is to give a lot of electrolytes to help
Mhm.
with that blood pressure and blood flow. Um,
Mhm.
it's the recommendation is actually 10 grams of sodium per day to give just understanding of that to people. If anyone knows Element, those packets that are LMNT, they're like really salty electrolytes, that's 10 packets a day. So I
Oh my
often don't have
gosh.
to go that high on sodium, but that is the conventional medicine recommendation for POTS. It's basically like, fill this blood volume up, get this person squeezed together, and get the blood flowing, essentially.
Yeah.
Um, Another type of POTS called hyperadrenergic POTS is that you're having like adrenaline dumping, and the approach to that would definitely be nervous system based.
Mhm.
Oftentimes they'll use blood flow medications, beta blockers like propanolol as well, in conventional medicine.
Mhm. Okay. What about the third one?
Neuropathic POTS, which is that there's actually some damage to organs or blood vessels that is causing the issue. I do see this as being less common, but it
Mhm.
definitely is quite real. Yeah.
Yeah. Yeah, when you go to your doctor, I remember when I didn't know anything about this and I would have blood pressure like 80 over 50 or 90 over, you know what I mean? They're like, "Oh, it looks great. You have great low blood pressure." And it's like, "Yeah, but I have to lay down after I take a shower and I get dizzy when I stand." You know what I mean? So, those are not good signs. So anyone listening, if you have really low blood pressure, you should get screened for this for sure. And I also find it comes along with hypoglycemia as well.
Yes, absolutely. Because that's going to trigger your nervous system. There's an emergency, and that will trigger the nervous system to inappropriately send blood to the area.
Mhm.
100 to the wrong areas, or not send it at all.
Yeah.
100%. I see the relationship with hypoglycemia as well.
How does this relate to hypermobility or like maybe EDS?
100%. Yeah. So, EDS, Ehlers-Danlos syndrome, is a cluster of genetic connective tissue disorders. Okay. I'm going to blow everyone's mind, I think. I don't know if it's
Come on
going to.
now.
Exactly. Our mast cells, these cells we were talking about, they live in our connective tissue. Ehlers-Danlos syndrome is a connective tissue disorder. So the activation of those mast cells happens because they live in the connective tissue So how it could relate to mast cell activation is if you hyperextend, if you do things that are instigating, basically it can activate your mast cells. And then also just the fact that you don't have structural integrity, because connective tissue lines our joints, our bones, our organs. Like there's connective tissue all over our body, which means there's mast cells all over our body.
Mhm.
And histamine issues can be in every part of our body, basically. If you don't have that structural integrity to hold you up, you could have, like, let's say, upper cervical instability, and then you're kind of pressing on different nerves. The nerves in your neck, our vagus nerve, which I know you've talked about a million times on this podcast, controls our heart rate by in some means, right? So if you have hypermobility and you have instability in the joints in your neck, that could affect the nerves, and those nerves control your heart rate. And your nervous system, as we know, your vagus nerve being a part of your nervous system, also controls those autonomic functions. And that's where a big way in which they're connected, I would say the ways that all three of these are connected is two places: connective tissue and our nervous system. And
Mhm.
the problem with histamine issues is that they can show up literally anywhere in your body. Severe insomnia, anxiety, tremors. Yes, you can get classic histamine symptoms like seasonal allergies, rashes, and things like that. But it's really like, I think of MCAS as being almost like an allergy to change or an allergy to being alive. Sometimes it feels
Mhm.
like,
Yeah.
unfortunately. And people have all these very odd symptoms that you really can't test for. And histamines can affect all of your vital signs. They can affect, um, obviously, like your signs and symptoms, things you can see, but they can affect your heart rate, fevers, blood pressure. Like if you go to, these are ER things that we go to the ER for, right? And it often can't find a root cause, which is really frustrating for people. And then
Mhm.
people also with hypermobility might have pain or similar symptoms, and it's hard to know sometimes where it's coming from. But I do see these three and also neurodivergence kind of running together for sure.
Right. How does
Yeah.
that relate with ADHD or maybe autism? How is that
Yeah.
connected?
So histamines themselves have been linked to ADHD. There's a genetic theory called the RCCX gene theory, which is that there's kind of a cluster of genetic SNPs, and they create like a behavior in the body, which is like towards this immune dysregulation and nervous system dysregulation. Autism and ADHD are of the nervous system as well.
Mhm.
So they kind of tie in that way. And then I believe there's a glutamate piece to all of this as well, from a genetic standpoint, and the end products being broken down that I think ties everything together too.
Oh my gosh, totally. I remember going down this geek road and I'm like, I think I have issues with glutamate because I can't take glutathione. It makes me feel
Yeah,
really bad. I can't take glutamine.
exactly.
And like things like MSG would really affect me. And different compounds that reduce glutamate made me feel better. Lithium made me feel better, like lithium orotate.
Hmm.
So it was all this
Absolutely.
is super interesting. And then I was diagnosed with SIRS. I had mold illness.
Sorry.
So back in
Yeah.
2020, I found out I was and people listen to the show know this, but my house was just laden with black mold. And I did a mycotoxin panel, a urine panel, and I still have the highest score to
Yeah.
date of any patient. I had just off the charts for
Oh my
black mold.
gosh.
So let's bring in the mold piece. SIRS, for people who don't know, and we've done a show on it, chronic inflammatory response syndrome, but basically
Yeah.
mold illness or biotoxin illness. But how is that linked?
Yeah. So, I mean, there's a, our mast cells also release cytokines, by the way, which is something that's very, very important because we've heard of the cytokine storm, especially in COVID. We've heard about cytokines in their role in inflammation, essentially. I think that mold puts our immune system and nervous system into a constant state of activation, and our mast cells are very involved with that specific type of inflammation as well. So and there it can cause mold can cause both like inflammatory damage and put the body in a state of constantly being on guard and trying to repair the issue. So
Mhm.
that's I would say it's both those things. And then I also see people doing a lot of really harsh mold detoxes. But if your liver doesn't have the nutrients to help to eliminate the mold and you just give yourself a bunch of binders and things like that, what ends up happening is you recirculate those toxins and then the body mounts an immune response and a mast cell response on those toxins and the cycle gets worse and worse. So most people who have mold issues I think do have a lot of mast cell issues as well because it's really an immune system that's on fire.
Right, exactly, and you can have 2 people living in the same house. One person, they're good, the other person, it's like they just fall apart based on their own unique genetics, how they process toxins.
And Dr. Lowe,
Um
I have to tell you this. This is so true. I was in the city on a Fifth Avenue apartment right across from Bryant Park. I had the best apartment. I had mold in that apartment and I was so sick all the time. And once I got COVID, it was just the explosion of symptoms, unlivable. But I was like, I can't leave a good apartment. That's how bad New York City is, by the way. The renter market is that like if you find a good apartment, you literally won't leave. And I walked into my husband's like generally very healthy. He does not live in a highly sensitive body. And I walked into our bedroom and he was like literally sitting at our desk and coughing up a lung like he was an interstellar. And I was like, all right, if by the time it's affecting him, we have to leave this apartment now because
Right.
it's affecting the normal person. So now I'm like, okay, now we have to go. But yes, everyone's different. It's because there are people who can live in moldy apartments, but they don't have that strong reactionary response from the body. And there's a lot of like with biofilms and our cellular structure, there's a lot that goes into it as well. But yeah, mold, much like COVID, will like expose your vulnerabilities really quickly.
Very true and important for anyone listening who maybe doesn't feel like they have a highly sensitive body, just to have that compassion that it's just different, that some people are just built differently and it's, we're not the same. How, so you mentioned, so all the symptoms that can come along with this, big things, anxiety, the fast heart rate, the low blood pressure, the dizziness, maybe like rashes, allergy symptoms. Are there
A
any
lot of
other things?
digestive, yeah, a lot of acid
Digest.
reflux, nausea, it can be diarrhea or constipation. A lot of vision issues I see with clients, frequency of urination. Almost like a lot of clients will think they have interstitial cystitis and get that diagnosis when they're in mold or have an MCAS flare and not realize like waking up in the middle of the night to pee. I would also describe the anxiety or depression differently than I would anxiety or depressive symptoms differently than I would other. A lot of clients who have histamine issues describe anxiety as being a very physical anxiety. So it's like you
Right.
feel like ants are crawling under your skin, like a zinginess kind of extreme insomnia, again, fevers, like it can look like you're just sick also. And that's really the problem with it. You can have high heart rate, have a fever, like your body is fighting something because your immune system is. It's just fighting something that is maybe a perceived threat and not a real threat. But I
Yep.
see a lot of those symptoms, a lot of again, when the dizziness comes, visual disturbances that happen as well as a result of it. A lot of body pain can happen too. This is where I think the connective tissue plus the MCAS kind of come together, and maybe even the POTS and blood flow. What's very characteristic of POTS is to have something called coat hanger pain, which which is basically like if you took your hands into like made it like into a little triangle and put it in the back of your head, it would be like from that occiput through your shoulders and feeling like they almost can't hold their head up. And that could be kind of a POTS and hypermobility duo where you're not getting the blood flow to the area. And basically in hypermobility, your body will signal to the wrong muscle groups or stabilizer joints the wrong ones to hold you up. So instead of this holding you up, it'll be like your neck holding you up. And then if you don't have the connective tissue to hold you up there, it can create instability and those nerves and the back of your head are going to control eyesight and going to control pain in that area. So I often have people icing their neck. So I see a lot of coat hanger pain as well. And then really just a lot of exercise intolerance, heat intolerance. Again, sensitivities to remember your mast cells are keeping like their eyes and everything in threat. So they take a B supplement, and my clients are like sick for 3 weeks. Like insensitivity to supplements, medications, and of course high histamine foods as well, which we can talk about.
Right, yeah.
Yeah,
Let's dive into the food piece of this, the food
yeah,
sensitivity piece. It can People who deal with this can feel like they can't eat anything because even foods that maybe normally would be okay, if they're sitting around too long, then they're accumulating
exactly.
histamine. So Let's talk about the diet piece and how to, work through that.
100%. Yeah. So it's really weird because the foods that are highest in histamines, I'm convinced are the healthiest foods in the world. So I
Right?
always know when someone has a histamine issue if they feel sicker when they go on a diet. Like if they
Yeah.
go on like a whole foods paleo diet and they're like, I am the sickest I've ever been, I'm like, you probably have a histamine issue. Or if they start exercising more and they notice they get sicker when they
Yeah.
exercise. So high histamine foods are either these are foods that either contain histamines or they enable the body to release histamines. Basically, we call them
Mhm.
histamine liberators, essentially.
Mhm.
So, citrus fruits, bananas, tomatoes, spinach, avocados, fermented foods. Again, if you were to ask someone, give me a list of the gut healthiest foods, the
Right.
healthiest foods in human existence, I would be listing these foods to you, basically.
Yeah.
And then fermented foods, again, like kombucha, wine, unfortunately, is a huge, huge trigger for people. Um, Even like miso, anything for soy sauce, anything
Yeah.
fermented, can cause a huge problem for people. Pickles, vinegar is also a major, major histamine food. And then foods, like you said, Dr. Lowe, that have been left out for a while, they have the capacity to leftovers have the capacity to grow histamines over time. I do
Mhm.
not like encourage very long-term low histamine diets because they're extremely restrictive and extremely unhealthy. Honestly, if you have to eat that way forever. However, if I have a client who eats a tomato and is sick and out of work for 3 weeks because they ate one tomato, I'm going to say in the short term, maybe we don't eat the high histamine food. So it's a
Right.
balancing act because it's objectively healthy foods, but the body's receiving the information incorrectly. The other thing about high histamine foods is the more that you eat, the more your body produces histamines, which is a really silly thing that our body does. I'm like, we already have enough, stop producing more. But as a reaction to seeing histamines, the body produces more histamines. So
Mhm.
sometimes it does take a short term elimination diet of high histamine foods to just see if there's some difference.
Mhm. What would be some just great safe foods
Oh,
that
yeah.
people can make
Freshly
sure?
cooked meat of any kind is safe. I find clients do really well with I like purple potatoes. A lot of grains are usually fine. I would say gluten containing grains obviously have a higher potential for an inflammatory effect. So I would avoid
Mhm.
those foods if this, I'm not telling anyone what to avoid, but if they were in this mindset, loads of fruits and vegetables are fine. It's really just avocados, spinach, berries, bananas, and citrus fruits that are of high concern. Other than that, most fruits and vegetables are great. So there's many options that you can eat.
Mhm. Mhm.
Again, almost all grains are low in histamines as well.
And then, depending on, like, the meat, like bacon or things like that would be high histamine, right?
Yeah, so if it's fermented or cured meats,
Mhm.
because they're aged, yes, aged foods have a higher capacity for histamine. So
Right.
fresher foods are always safer.
And if you cook a meal and leave it in your fridge for 1, 2, 3 days, it's gonna accumulate histamine, right? So even if
Yes,
it's
and
something fresh.
everyone reacts to things differently. So you have to tell like I don't notice that leftovers affect me necessarily,
Mhm.
but for other people they do. So you also have to like see what's your thing. Like I can eat tomatoes now, but I can't eat pickles still, which is like
Mhm.
very sad as a Jewish New Yorker. I mean, it's a big part of our diets. Like I'm very sad
Right.
about it. It's like our whole family thing is pickles. But it really depends on the person and what they react to. It's the same thing where like I could lay in the sun like a lizard all day and have no vasodilation issues and no dizziness. But for other people, that's a huge trigger. If I go in the cold, I'm like, I have a huge histamine reaction. So it really just depends on the
Interesting.
person. Anything that your body perceives as a threat, and or just there's random reactions that people have.
Mhm. Yeah. And also, like living in a bubble, right? A lot of these folks feel like they have to live in a bubble forever. And I always encourage people that's not the way that you
No.
want to be living. Maybe for a short period of time in order to reduce some of these histamine issues and this inflammation and
Yes.
while we're working on the nervous system. But ultimately we want people to feel resilient and have flexibility and freedom in how they live their life. Keeping in mind that probably still live in a bit of a highly sensitive body,
Yeah.
but where it's not as sensitive.
You're 100% right. This is something that our mutual colleague, Dr. Robert Kochko, always says, which is that our nervous system learns by example. So our life is as big as our nervous system believes is safe. So if we play it really safe and we play small, that's as big as our nervous system thinks our life can be. If
Mhm.
we continue to expand our lives and make them bigger, I write these client plans all the time. I call them battle plans, so corny, but I call them battle plans because I'm like, we have to target lifestyle, like everything, all the way down. And always when I have MCAS clients, top 5 goals is going to be make your life bigger. It's never to make your life smaller. So it's weird because these mast cells and these conditions, they're all syndromes and they're kind of cyclical. So you'll get a symptom, you'll react because that symptom's freaking scary. Like imagine you're dizzy after being in a shower and feel like you're going to faint, your heart's pounding. Like these are really scary symptoms. And then your body goes, what the heck was that? I never want that to happen again. I don't think I should shower anymore. I'm going to not leave the house. I can't even be in the house and feel safe, right? So the
Yeah.
problem is then our body mounts a nervous and limbic system response to the symptom, freaks out, and then new immune problems happen because the body's like, now we're really unsafe. So you have to kind of crack into that. And a big part of healing from these syndromes or conditions is you have to be like a ridiculous level of positive sometimes. And it's so hard. Like there was a time I couldn't walk and I literally, because my heart rate was so bad and my neck was so injured that I literally had to lift myself off of a computer chair to bring myself to the bathroom from the office. I was still seeing clients. I would just prop myself up on a wall with a neck brace. And
Oh my
I was like, can
gosh.
you guys take me like this? And they're like, yeah, we'll take you like this. I'd rather than not see you. I'll take you like this. I'm like, guys. But it was also like the only thing that kept me happy. But I remember walking into my bathroom, like after lifting myself, and then I was holding myself up to see the mirror when I was on the toilet. And I remember being like, you're just never going to get out of this, Michelle. I just don't
Yeah.
think you're going to make it out of this. And then I heard another part of me that was like, don't ever say that again to me. Don't ever say that. Because
That's
once
the New
you say
York
that,
side. The New
exactly,
Yorker was like,
me and my combat boots, like you're
Yeah.
never going to say that again. Right. Like, and that is kind of what it takes is you have to be, unfortunately, in the darkest moments of your life, like have this blind faith in yourself that something's going to change. And that's why a lot of the programs that help with chronic fatigue syndrome, mast cell activation syndrome, and POTS are brain retraining programs. The Gupta program, DNRS, Primal Trust, they're all brain programs. They're not supplements and all these things. It's about creating safety when you don't feel safe, which is the hardest thing in the
Mhm.
world. And I know it is the hardest thing in the
Absolutely.
world.
That was going to be the next. That's amazing. You read my mind. It was like, how do people start to work through this? Because it can feel, because one of the symptoms with this is brain fog, anxiety. It can
Yes.
feel so hard to even know what the next step is. So for my patients, let's say they've been dealing with chronic candida issues or chronic heavy metal issues or SIBO, or, it's like just one thing after another, chronic viruses, parasites. I always love to take a step back, screen for these kinds of symptoms and say, let's start with the nervous system, and I don't even want to
100%.
have you take one supplement until I see that you're really focusing on this part. And what happens is they develop more resilience. And let's
Hmm.
say, yeah, maybe they are dealing with a mold exposure. They're able to handle it better, right? It builds them up. So,
Yeah.
let's say someone listening is dealing with this, and we're not obviously treating or giving medical advice, but just saying theoretically,
Yeah.
some things that they can do first. What would that look like?
100%. Yeah, you nailed it. So it's going to be treating the nervous system and treating histamines. So I'm going to give you a quick example of a client of mine, an experience we had. So I had this amazing client who came to me. She was on 8 psychiatric medications on and off for insomnia. So sometimes they would put her on a combination of 4, but there were 8 trialed medications: Ambien, Trazodone, Xanax, like Zoloft, Prozac. Like they trialed everything to just literally try to tranquilize her to go to sleep. She
Mhm.
went 21 days sleeping less than 3 hours a night. So at this point, you're hallucinating. At this point, you're completely paranoid in your environment. She was tortured, Dr. Lowe. Honestly, she was in a state of torture. And for like this was so many years ago. And this was like 5 years ago. This was like before COVID. And I had like a download about her, and I was like, I think this is like a histamine thing because histamines are very like arousing. They're very arising. Remember, they want to keep you alert, see if anything's, about to happen. So I was like, let's just try Pepsid. So I had actually read a study about, so it had to be after COVID because this was a long COVID study. I had read a study about how they were using Pepsid to treat long COVID. And I was like, is long COVID an acid reflux issue? Why would they use Pepsid? Pepsid is actually an antihistamine. And because it works on your gut, I think it works on your vagus nerve. So I gave this client a Pepsid and I said, just take a Pepsid and let me see. It's been 4 or 5 years and she has slept every single night perfectly since then.
It's
So my
amazing.
my point in saying that is thank you and thank God. She's like she's so freaking healthy now. I'm like, you're like doing 100 times better than me. She's like the healthiest person I know now. She's amazing. But the reason I say that is because if you have a histamine issue and histamine is driving your anxiety medication even might not be enough. If it's a histamine issue, you have to lower histamines. So I'm a functional practitioner, you're a naturopathic practitioner. It's like, I don't want to say sometimes over the counter medications are quite necessary, but in the case of histamine issues, you have to bring the histamines down first.
Yes.
And then also it's nervous system and histamines. That's round one. Before you start doing a targeting the root cause by, oh, let me go kill some parasites. Let me do a heavy metal detox. Have to stabilize the nervous system and histamines because
Mhm.
anything that you put in that system that feels a threat is coming, you can't rip stuff out of your body when your body feels like it's threatened. So the
Yeah.
first thing is you have to make the body feel safe and you have to physically bring down histamines. You can do that through over the counter medications, or you can also use like perilla extract, ginger, Dow supplements,
Mhm.
PEA. There's loads of support you can do from a supplement kind of holistic perspective, but I'm never afraid to use antihistamines. I'm more afraid to use
Yeah.
like Benadryl, but H1 and H2 antihistamines, Zyrtec, Claritin, Pepcid, I will use them when clients first come to me because it can
Mhm.
create so much relief so that you can actually start to focus on the root cause and everything like that too.
Right. What do you find about the anxiety medicine hydroxyzine or Visceral? Because that's an antihistamine as
I was
well.
gonna say, well, I think that that's like a good combo, probably
Yeah.
for people because it has the antihistamine effect and it has the anti-anxiety effect for sure.
Right.
Yeah,
Yep.
I think if people have not found relief from classic anti-anxiety medications, or if they are using benzos and they don't want to use them long term for the obvious reasons, we don't want to use benzos long term. Um,
Mhm.
Finding other solutions might be really helpful for people, and that's why like Unisom during pregnancy is so commonly used too.
Right.
For sleep, it's an antihistamine.
Yeah, that makes perfect sense. I've found for a few of these patients, there's been a bit of a dependency towards using cannabis. And I think that can be something that can make it worse, right? Because a lot of
Yeah,
cannabis is mold contaminated, and I think it can lead to worsening histamine. What are your thoughts on that?
I definitely think so. So if we're going like really Eastern too, I think that if we can for a minute, I don't know, again, I'm going to be potentially wrong when I say this and I'm okay to be wrong. I think of cannabis as being dampening and I think of like mold, like I think of it as being dampening and
Hmm.
that's why people I think like it because it mellows the system
Right.
out. I don't know if this is technically correct in TCM or Ayurveda and I'm completely open to someone correcting me on this,
Hmm.
but I do think of it as more dampening and I think of MCAS and POTS as damp conditions of dampness. So
Hmm.
that's why I like ginger, something that brings like digestive fire and heat back. But I also understand the wanting to use things like cannabis to help calm the nervous system. There are herbs
Right.
also like I think passion flower is really fantastic. If you can tolerate like glycine powder, sometimes people can tolerate GABA as well. Like there's other ways to
Hmm.
go, and also the fact that anything that creates dependency is going to create withdrawal. And
Right.
even though I know that weed's not addictive, but okay, but it does
Yeah.
create
Oh, I
dependency.
find
So
it's
yeah,
addictive
exactly.
for sure.
Yeah,
I've definitely
exactly.
seen that. That makes sense because antihistamines can be drying.
They're
So,
very drying. They're
yeah.
extremely drying. Yes, that's why I think that exactly. That's why I think that and also Pepsid is not only drying, it's like bitter. So I think that the bitterness helps to transform the dampness. So that's my secret about what I think is happening with some of this too. So I think
Hmm.
anything that is very like damp is going to bring people down
Yeah.
more than back.
That
Yeah.
makes sense, and also,
Yeah.
like, damp weather can
Oh
worsen
my
these issues, I
gosh.
find,
Oh my
if you
god,
live in a
especially the
really
pain.
humid place. Yeah.
Absolutely.
Um, is there an easy way to handle the diet part of this? Like, are there any certain meal delivery companies you like or ways to just do this easier? I know, like, I think it's North Star Bison. I think they have like low
Oh, I don't even
histamine
know about that.
meals. Yeah, because they freeze them within like 12 hours or
Oh,
something.
that's
So
amazing.
they're not sitting for a long time, but
I'm deferring to you on this. I have to be honest. I
yeah.
don't, there's like no meal delivery services in New York City that I find that are like
Mhm.
fresh up. We have like Daily Dose, which is really good. And the owner, Trishy is amazing.
Mhm.
Trisha is amazing. However, it's still like you have the meals for 3 days. So I don't know.
Right.
It's really like you would just have to food shop frequently or cook for yourself in the beginning.
Yep.
However, I never needed to. I could like get Sweetgreen and the food is like cooked. Just don't have leftovers as much
Mhm.
and try to just I would go to places that you clearly know what the ingredients are as well. That's why I do like the transparency of Sweetgreen, because I can like see all the ingredients, which I don't know if it's the healthiest thing ever, but it's
Yeah.
easy when I need something easy too. Yeah.
Right.
Yeah.
Right. And then you can cook and freeze your own food, right? And thaw
100%, which
that.
would
That
be
could
the
be an easy
best.
way.
Exactly. Because the
Yeah.
freezing process thaws I mean, it stalls the histamine process. Exactly.
Right. Right.
Yeah.
Love it. Um, okay, girl, I might have to have you back for a part
All
two.
right. I'm here. Okay. Yes.
Are there
Okay.
any other like final thoughts on this, that you want to leave with our listeners? This is so
Yeah.
good.
I feel like with these syndromes and conditions, if you've had them like we have, Dr. Lowe, like you can feel so backed up into a corner. And I promise you, doctors, if they're telling you they don't know, they really don't know how to help. And it's just, I have to say, and this is very controversial, I believe that conventional medicine is not the place for MCAS. And a lot of people will go to get like mast cell stabilizing drugs, antihistamines. It has to be treated with a lot of attention and care, and you have to be constantly moving as it moves. I think
Mhm.
MCAS calls us to look inside and see what and ask ourselves what makes us feel safe and what we need. And I think MCAS calls us to go slower in every
Yeah.
area in life. MCAS, my clients who are the histamine clients are the fastest moving, smartest, most
Yeah.
productive, amazing people you will ever meet in your life. And this is their body. That's exactly right. A fellow
Sorry.
HSB. Exactly. And at the same time, when we are seeking those answers, we're like, what supplement is going to fix this? Is anything going to fix this? Um, we have to just learn to be tolerant with what's going on inside of our bodies, which is the hardest thing in the entire world, less
Yeah.
reactive to the symptoms, and really just tracking pattern recognition, understanding, and being able to look at the body through what it's trying to tell us. And it's just a process of really getting to know yourself and then having this like crazy toxic positivity belief that somewhere, somehow, it is going to get better, because I just can promise I have seen so many people live such huge lives with histamine issues and living in highly sensitive bodies. It is going to get better. We
Yeah.
don't know how, but it always will, basically. And
Yeah.
it's like you put those things in place and they just will come together. So I just want to send a lot of hope and love and just let people understand, like, I know what sickness can look like and what chronic illness can look like, and that it's not this thing where you can just take a supplement. And I know there's going to be people commenting to the people listening to this and being like, well, have you tried this? Have you gone to doctors? Like, yeah,
Right.
I've been to 100 doctors. Yes, I've already tried everything. We are the people who those things don't work for. Listen to yourself above anyone else and just have this wide-eyed belief, and you really are going to get there.
Own your unique lane. Nobody else
Exactly.
drives in your lane, and just trust your body's designed to be healthy. It's going to heal just one little bite at a time, and starting with that nervous system piece,
Exactly right.
that's really huge. Yeah. When I came across DNRS, I actually had Annie Hopper on the show, who
Amazing.
created DNRS. Amazing.
Exactly.
And I've just seen such incredible things with that,
And Gupta program too. I had a show
Mhm.
Gupta on my podcast too. He was and the it's just like, I don't know how to say it. Like, they nailed it. There is like at the core of these things is this constant cycle of, we have a symptom, we react to the symptom. And it's so funny because I remember Dr. Kochko, we got to give our ND shout outs as many times years ago, like 10 years ago, I'm talking about. And I would go to him for acupuncture. And this is such a weird thing. I was in the acupuncture chair, and it was the first time he was doing acupuncture with me. And I said, is this going to make me feel high? Is this going to make me feel weird? And then he literally looked at me and said, would it be the worst thing in the world if you felt good for a second? And I said, yes, because it's unfamiliar to me. Of course it would. So it's also about like tolerating feeling nothing and tolerating feeling something. And it's this like windy journey. But I have never seen a client who their mindset is in the game and then they say, I'm going to change and this is going to get better, and them not get better. I've just never
Right.
seen that happen. And I've never
Yep.
seen a client recover when they aren't in that mindset. And it's so mean to say almost, because it's like, but Michelle, don't you know how bad my symptoms are? Like, I know I'm asking you to go against everything that your body is telling you, which is why these programs exist. Because that connection between when we have a symptom and then we freak out about a symptom is the core of these syndromes, the core
Right.
of these
Yep.
syndromes.
Yep, 100%. Oh, so good. Well, I just love all of this. I'm sure everyone listening is just digging into it and loving it. And make sure you guys follow Michelle, check out her podcast, Quiet the Diet podcast. You can follow her over on Instagram at Michelle Shapiro D. No, Shapiro RD. And then Michelle Shapiro RD.com is her website. So check her out. There's hope. There's
Oh my
answers.
gosh,
You guys are
100%.
loved. You're you're strong, you're resilient, you can do a lot harder things than you realize. So just keep that belief in yourself. And really thank you so much for your time today and giving us some
It was
hope.
my absolute joy to talk to like a like-minded HSB kindred spirit. So I'm so happy to sit down with you. Thank you so much for having me.
Mutual love.